All right, let's focus in then on HealthPlix, which is basically a startup that offers in-house platform for doctors to help record the patient data digitally. They've recently raised close to $22 million in fresh investments. Let's connect then with Sandeep Gudibanda, who's the co-founder and chief executive of the company. Sandeep, thanks so much for taking time out. I just want to understand, given our rapidly expanding population, we have seen cases of many doctors not really finding enough time to assess adequately each patient. How is your platform, HealthPlix, really solving this via the freemium model?
Sure. Yeah. First of all, thank you for this opportunity, and that's precisely the right question that one should ask on how one can digitize the healthcare platform, healthcare in India. Right? The key question is, like you mentioned, doctors would not have time to even treat the patients. They typically get about 3 to 4 minutes to treat each patient, and if you're taking away a significant amount of that time to do data entry, they're not going to adopt, right? So that's a reality. So HealthPlix is not the first EMR that has come to the country, and it's after HealthPlix there have been hundreds of other EMRs that have come as well, right? But what HealthPlix has done well is to say that we're building this software for doctor, right? We're not building it for an administrator. We're not building it for a policyholder, right? So for doctors, it takes less than 30 seconds to write a prescription. So it can do that because it's very intelligent, understands from the doctor, learns from his own practice, what brands is going to write, what complaints is going to write, etc., etc. So by the time he's written about 25 prescriptions, it takes less than 30 seconds, right? He does about 8 characters, get 500 character worth prescription, right? So you need to understand this piece well to get doctors to digitize, right? I think that's precisely what HealthPlix has done. And we today, about 3% of entire doctor fraternity uses HealthPlix, and there's a lot of white space, as you understand, right? Our goal is to get to 100% of that population.
Okay, fair enough. So just walk us through then how much you've raised so far. The latest round is $22 million. Who are some of the investors that have participated, and what is the total fundraise right now? Any details on what the valuation could potentially be for HealthPlix?
Yeah, we've raised about $22 million. SIG and Avataar are the lead investors for us. Every single existing investor has participated in us, right? So 20 million in equity, 2 million in debt. That's the overall construct of fundraise for us, right? I mean, as India is going through a digital revolution in healthcare, some of these investors understand the fact that HealthPlix is a doctor-first firm. We realize that anything that needs to happen in Indian healthcare needs to happen through a doctor. So both SIG and Avataar understand that, and then that's one of the reasons why we sort of zeroed in on them, right? I mean, SIG is big on unit economics. They've seen us for a long time. Avataar is big on SaaS, so it's not like a speed dating thing, right? Anymore, investments. These firms have been tracking us. They've seen us how we respond to various challenges, whether it is global, local, internal, external, etc. Right? So that's how we ended up raising from this. It's been a phenomenal journey. Of course, funding winter is here. Raising funds with almost like 2x the valuation that we had done last time. I think it's kudos to the team, right? Thank you.
Yeah, and despite that funding winter, you have managed to raise funds at a time like this. So I know that AI is really at the forefront of what you guys do in terms of aiding technology, providing real digital solutions. How exactly does it work? Because it's helping to write the doctor's prescriptions, even search for appropriate medicines and diagnosis. So you're using AI to do this?
Yes, absolutely, right? So, see, I mean, you look at the vision of HealthPlix, right? So we're not just there to digitize healthcare, right? So we're there. HealthPlix exists today because we want a better health outcomes at a population level, right? Which means it's not just about making it easy for doctors to write the prescription, but helping doctors to tap into his own wisdom to think of the right treatment for the right patient at that time, right? So that's when we would have done our job. I think HealthPlix has come a long way. Today, about 2.5 crore unique patients have been treated in HealthPlix, and every single consultation is an opportunity for us to add, drive health outcomes. How do we do it? We do this at 4 levels, right? We sort of leverage AI to understand doctor specialty, his own preferences. Every doctor's practice preference will be different. We understand patient's disease. We understand the stage of the disease, right? So we go 4 layers to help doctors, sort of one, as I said, understand what has happened in the last, couple of years, couple of visits for the patients, understand what treatment worked for him, what did not work, so that he can pick the right one right now. So just a longitudinal view of the patient, disease progression itself will help him do that, right? So on all of these things, we leverage collective intelligence, we leverage AI to help doctor for that one consultation, right? So, like I said, right treatment for the right patient. It could be alerts based on the risk profile of the patient. This patient is high risk for thyroid. This patient is high risk for liver. Or it could be things like in this geographical area, there's a lot of dengue cases coming up, or there's a lot of upper respiratory tract infection coming up, right? So for all of these things, as you can see, with having treated about 2.5 crore unique patients, having done about 70 million unique consultations, having, we do about 100,000 consultations on a daily basis. That's a lot of data that we can leverage to help doctor on that one consultation, right? When he has 2 minutes, 3 minutes to treat the patient, we want to be the assistant that doctor can rely on, right? So we do that, and there's a lot more for us to achieve as well. But we're happy with what we're currently doing.
What are the current revenues that you enjoy, the FY22 revenues? How have they grown over the last year? And what is the projection going down the line?
Sure. So, I mean, as a firm, we have been fundamentally looking at, getting the fundamentals right, right? So, first couple of years, we just built out the product. It meant adopting, getting doctors to adopt a digital EMR meant everything for us, right? So, when you think about revenues at that point of time, we just went out to get doctors, right? So that's a couple of years of journey. But last year, 2020 onwards, we've been monetizing this. So our revenue multiples have been about 3x last year to now, because and gross margins are very high, right? 85% sort of gross margin level. So this year to next year, we're thinking about growing that to about 3.5 to 4x. So we have ambitious goals. But I mean, given the track record, given that doctors are increasingly adopting technology, we are super confident that we will get to those numbers.
All right, super confident that you can continue to grow. So what exactly is it in terms of how it works? Because you're helping doctors really create a 360-degree medical profile of their patients. So how exactly is this helpful in, treating a lot of diseases? How does it work in terms of the patients, helping patients to really understand what has been prescribed, and given that you're using AI, does that, just relegate it to just English as a language?
Yeah, absolutely not, right? I mean, doctors write in English when it is getting printed out or when it is getting sent out to a patient. It can be converted into 14 different languages. A lot of structured things which patients need to understand in their own language, where compliance will go up, etc. Roughly about 60% of our all consultations, while doctors would have written in English, when they're printing it out or when they're sending it out, it is in their vernacular language, right? So the doctors who use HealthPlix on a daily basis are on 12 different languages, right? So that's one of the reasons why HealthPlix adoption has been very, very key. So that's on the language bit, but you did touch upon how are we increasing, how does it work, right? So we believe doctors are heroes, right? I mean, they do so much for all of us. So I keep telling all my employees that they're like superheroes, Batman, right? At HealthPlix, we want to be Robin for that Batman, right? I mean, we want to help him tap into his own wisdom, right? A patient is sitting right in front of him, just showcasing the disease progression, right? I mean, like for example, diabetes, there are about 512 different ways in which it is being treated on HealthPlix platform. And if it doesn't work for that persona, doctor needs to change the treatment, right? Now, he may have employed multiple treatment regimens in the past. Just showcasing what worked for that patient, what didn't at that moment, would help doctors to pick the right one. Now, let's say there's a patient whose, diagnosis has been made as chronic kidney disease, and in that there is a stage, let's say CKD stage 3. For that stage and for that disease, what doctors should look at, I mean, a bare minimum is something that shows up on HealthPlix platform, so that even if he's spending just 5 seconds looking at the glancing of the screen, he should not miss out on the most basic things. So that's how we keep thinking, right? How do we give information back to doctor that will allow him to sort of bring out the right knowledge that he already has at that moment, right? So that's the way we sort of leverage data, leverage AI, leverage doctors' time on the platform, etc., to improve health outcomes.
Wanted to understand what your funds will be utilized towards?
I think the one that we're talking about, right? So we want to be serving to the vision of the firm, right, which is to improve health outcomes. So hence there are a lot of clinical decision support algorithms that we want to build out for many diseases. That's going to be the first thing, which means that we need to double down on the engineering, effort, number of people that we need. We're going to double down on number of doctors that we can onboard onto the platform. So while we're not looking at anything outside India, but we will explore, because as I said, 3% of entire Indian doctor fraternity uses HealthPlix. The goal is to get to 100%. That's where we will be allocating the funds to.
There have been a number of business models that have been very close to this. There are already a lot of companies that adopt in this, that are working in this space. You know, the EMR platforms in India that we've seen, electronic medical record platforms that really claim to have doctors help treating their patients a lot more efficiently. So what is the standout factor? How do you plan to really take on the competition and stand out?
Yeah, I think competition is good. Like many entrepreneurs say that competition is good. That means there's a real opportunity here. Roughly 70-80% of all the doctors who use any EMR use HealthPlix, which means we are the leader in that space, right? And significant at that. But are we super big? As I said, only 3% of doctor fraternity users. So there is so much more white space. So there is room for many players, right? But I've seen many entrepreneurs who come in and then say we will change this in healthcare with the right mindset, right? But getting healthcare digitized is not an easy job, especially now with the funding winter happening. We see so many entrepreneurs struggling. So which means there's a consolidation opportunity that is coming up. So we will be, sort of mindful of what opportunities come up. So we are working on a couple of them right now. But we will be conservative at it, right? It needs to come at the right price. The expectations, of course, have gone down. But I think competition is really becoming a consolidation opportunity, given the market conditions now, to be very honest.
Okay, and how many doctors are you currently servicing? What specialties do you have? And how many patients have been treated using the platform so far? What's the expansion plan on this front?
Sure. So when I say a doctor is a user for us, he has to be using it for 100% of his patients, whether he's doing a teleconsultation or in-clinic consultation in his own clinic, right? So that's our user. If it's just listed on a marketplace, etc., that doesn't become our user, right? So our users spend on an average 4 hours on a daily basis per doctor per day, which means the traction is very high. There are about 11,000 such doctors who use HealthPlix on daily basis. Through them, we treat about 110,000 unique patients, unique consultations on daily basis. So far, we have treated about 2.5 million unique patients on the HealthPlix platform, and we have done about 70 million unique consults. Coming to the specialty, we are big in super specialty, which means MBBS, MD, and DM, right? People who are super specialized are the likely users of HealthPlix because they are the ones who are a lot more clinical. Also chronic diseases where you need to arrest the disease pretty early, which means early intervention is important. So for those reasons, we've chosen those specialties. But of course, in the last couple of years, we've expanded to acute and episodic specialties as well.
All right, Sandeep, we'll let you go on that note. Appreciate your time. Thanks so much for joining us on Startup Central. Let's